HIV symptoms in men. After 1 week, HIV signs in males after 1 week. Did you know that HIV signs can appear in males just a week after exposure? That's correct. In this video, we'll explore the 10 possible signs of HIV in males after just 1 week. Staying informed about these signs is essential for early diagnosis and treatment. So get a pen and paper ready, and let's begin. HIV signs. Early diagnosis and treatment of HIV are vital for managing the virus and preventing further harm to the immune system. So let's delve into the 10 possible signs of HIV in males after just 1 week. 1. Fever and flu-like symptoms. The first possible sign of HIV in males after 1 week is fever and flu-like symptoms. This occurs because HIV attacks the immune system, making it more difficult for the body to combat infections. Common flu-like symptoms include fever, chills, and body aches. If you experience these symptoms 1 week after potential HIV exposure, seek medical attention. 2. Fatigue and weakness. HIV can also cause fatigue and weakness. The virus can impact the body's energy levels. If you feel excessively tired and weak 1 week after potential HIV exposure, it's important to rest and seek medical attention if symptoms persist. 3. Skin rash. HIV can also affect the skin, causing various rashes. These rashes can be itchy and painful, appearing as red bumps, blisters, or sores. If you develop a skin rash 1 week after potential HIV exposure, it's important to seek medical attention for a proper diagnosis and treatment. Sore throat and swollen lymph nodes. HIV can also affect the lymph nodes and throat, causing a sore throat and swollen glands. If you experience these symptoms 1 week after potential HIV exposure, it's important to seek medical attention. 5. Headache. HIV can affect the brain and nervous system, causing headaches. If you experience persistent headaches 1 week after potential HIV exposure, it's important to seek medical attention. 6. Nausea, vomiting, and diarrhea. HIV can also impact the gastrointestinal system, causing symptoms such as nausea, vomiting, and diarrhea. If you experience these symptoms 1 week after potential HIV exposure, it's important to seek medical attention. 7. Muscle and joint pain. HIV can also affect the muscles and joints, causing pain and discomfort. If you experience muscle and joint pain 1 week after potential HIV exposure, it's important to seek medical attention. 8. Night sweats. HIV can also disrupt the body's temperature regulation, causing night sweats. If you experience night sweats 1 week after potential HIV exposure, it's important to seek medical attention. 9. Weight loss. HIV can affect appetite and weight, causing weight loss. If you experience weight loss 1 week after potential HIV exposure, it's important to seek medical attention. 10. Dry cough. Finally, HIV can also affect the respiratory system, causing a dry cough. If you experience a persistent dry cough 1 week after potential HIV exposure, it's important to seek medical attention. When to test for HIV. If you believe you may have been exposed to HIV, it's important to get tested as soon as possible. The timing of the test depends on the type of test you are taking. If you are taking an HIV antibody test, wait at least 2 to 8 weeks after exposure before getting tested. This is because it can take time for your body to produce enough antibodies for the test to detect. However, if you are taking an HIV antigen test or an HIV RNA test, you can get tested as early as 9 to 11 days after exposure. These tests detect the virus itself rather than the antibodies produced by the body. It's important to note that if you test negative during the window period, you should get retested after 3 months to confirm the results. It's also important to talk to your healthcare provider about your risk factors and determine how often you should get tested for HIV. Regular testing can help detect the virus early and ensure proper treatment and management. That's all for today's video on when to test for HIV. Remember, early diagnosis and treatment are crucial in managing the virus and preventing further damage to the immune system. If you believe you may have been exposed to HIV, don't hesitate to get tested as soon as possible. Always remember to practice safe sex and take necessary precautions to protect yourself and others. Thanks for watching, and we'll see you in the next video.